Good afternoon and welcome everyone to our seminar Sampler this afternoon. This afternoon, we're very pleased to be talking a bit about professionalism, which is one of my favorite topics and probably one of the most challenging of the ACGME competencies. We have three presenters with us this afternoon from St. Luke's: Lynn Unikel, Lauren Stone, and Zishan Vay. For those of you that are not familiar with the FMEC, I am the immediate past president and a member of the board. We like to say that we bring people together to get things done. We represent 14 states in the Northeast US, and we serve over 16 medical school departments of family medicine and about 200 family medicine residency programs. I'm happy now to turn it over to our presenters for our presentation this afternoon.
Hi, good afternoon, everyone. Can everyone hear me? Good. All right, so our presentation is called 17+1, Why is Professionalism Mentioned So Often, ACGME Requirements, and How Do You Actually Teach This? This is we did this as a class, whole class, all three classes, PGY 1, 2, and 3, and the attendants participated originally sometime in the spring of last year and the fall of last year, where we were trying to teach professionalism from different viewpoints in different ways. And this was what Dr. Unikel and Dr. Strom designed to help us as residents really understand what is the purpose and how to utilize our own residency training to better our own professionalism standards. And this whole presentation here is interactive. There will be portions where we used in our own presentation QR codes so we could do a little bit of adding to the presentation slide when there was like some gaps in there where you'll see as we're asking you questions and stuff. But we'll be utilizing the chat feature instead here. That way, because it's a smaller group and we won't have to worry about using the QR code or anything like that today. So without any other interruptions, let's continue going. And this is our contact information. And here's our faculty disclosures. And here are our learning objectives. So today, participants will leave the session with an example of, I'm sorry, give me 1 second. My panel just, there we go. We'll leave the session with an example of interactive didactic session in professionalism. Participants will discuss how to identify examples of professionalism and acknowledge it. And then participants will discuss examples of unprofessional behavior and will participate, like suggesting remediating it, how to remediate it, what are the best ways of remediating this.
Okay, so we're going to start by asking you, before we get into sort of some definitions and some literature on this, when you think of professionalism, what do you think of? So if you want to, again, just use the chat and kind of answer this question of what is professionalism? This is the interactive part. Following AMA ethics code, do what you say you're going to do. Okay, I couldn't tell if someone was still typing. All right, thank you for participating. And if another one pops up, we'll jump over to that. Yeah, professionalism's complicated. And it's something that we talk a lot about, that's important, but how do we define it and what is it? Doing the right thing even when no one is watching, right? All of our professional organizations have ethics codes. What does that mean and how does that tie into professionalism? So a couple definitions. So just starting here with a non-medical definition, professionalism does not mean wearing a suit or carrying a briefcase. Rather, it means conducting oneself with responsibility, integrity, accountability, and excellence. It means communicating effectively and appropriately and always finding a way to be productive. It's the US Department of Labor, which is, you can see some of that in this, but right, it's not about how we show up. physically, it's not, it is how we show up physically, but it's sort of, it's not just about what we are, but it's about, you know, like, what are we bringing with us when we show up? Our responsibility, our, as we said, not just when people are watching, but like being the best we can be, and sticking to what we know to be best practices and the best things for our patients and our teams and our colleagues. So another definition, from JAMA, professional competence is the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection in daily practice for the benefit of the individual and community being served. So again, it's how we're presenting to others. And this I liked really too, because it's in our daily practice. It's something that should be part of who we are and what we do. A definition of medical professionalism from the American Board of Medical Specialties is a belief system in which group members declare to each other and the public shared competency standards and ethical values they promise to uphold. Again, continuing on with this, it's so much a part of how we work together with our patients and with our teams. So why is it important? This is probably rhetorical, but right, the primary rationale for professionalism and collaboration is also patient safety. If we're not working together, if we can't treat each other with respect, if there's dissension within our teams, if there's dissension within how we work with our patients, then we're not providing good patient care. Healthcare is delivered via teams of professionals who need to communicate, respect the principles of honesty, respect for others, confidentiality, and responsibility for our actions. There's also been some recent work I was reading since we did this, that it connects remediation with burnout and professionalism. So sort of another way to loop all this back together too, because professionalism can be an area for remediation, and how working through that can decrease burnout in learners. So again, this is another slide, but just sort of what are some professional responsibilities? And this was from something called Medical Professionalism in the New Millennium, a Physician Charter. So a lot of the same things we've talked about is competence, honesty, confidentiality, appropriate relations, quality care, access, distributing finite resources, scientific knowledge, trust, and responsibility. So I'm going to now ask you, after, to use the chat again, but after reading these various definitions, would you change your initial response? And this is just a yes or no question, sort of to that first definition of professionalism. Would you change what you thought after reading these? Yes or no? We got one yes. Any other responses? One no. Someone said they would add to it.
That should just wait, because even when I get my score back, I'm going into, I forget what they call it. They come up with new names every year. Yeah.
Another no. So a little bit of mixed, sort of maybe some changes. So again, just thinking about kind of what brought you to your original thoughts when we asked the question, and how did these definitions lead you to where you are? And we, for lack of time, because we want to kind of get into the rest of this presentation, but just some things for you to think about.
Okay, so why do we focus on professionalism? So it is a core ACGME competency that happens to be mentioned 17 times in the common program requirements and an additional time in the family medicine requirements, hence our title, 17+1. It's mentioned in relation to program directors, faculty, didactics, residence development, sponsoring institutions, ethics, and well-being. And the thing about professionalism is that we notice it when it isn't there, but we often forget to acknowledge it when we see it. So it's not just the ACGME that emphasizes professionalism. So let's review the literature out there surrounding this concept of professionalism. Duff in 2004 shared that unprofessional, oh, how did I go backwards? Oh. There we go. Unprofessional behavior is one of the most significant reasons for disciplinary action against 3rd and 4th year medical students, residents, fellows, and practitioners, which isn't really that surprising to us when we think about it. There was another study that was specific to pathology that showed program directors see lapses in professionalism related to honesty, recognizing and reporting medical errors, interpersonal interactions, and conflicts of interest. And other issues seen with lapses in professionalism include attitudinal problems, interpersonal conflicts, inappropriate behavior towards staff, peers, faculty, or even patients. There was a survey conducted of 29 pathology residency program directors that found concerns about professionalism arising in those following areas. So I'll give you a second to take a look at those, but I don't think any of those are really surprising to most of us. Now, physicians with disciplinary actions in medical school for unprofessional behavior were more likely, according to Papadakis in 2004, to have disciplinary actions from their state medical board. This piece of literature also cited qualities of professionalism that you can see there in the table. Now, according to David Chestnut, competency that requires character and lifelong learning commitment and practice is another thing, another way to say professionalism. So humility here is learning the names of the people you work with, getting to know your staff. A person with humility doesn't usually know that they have it, right? They listen, they acknowledge when they're wrong, they work to be better. Servant leadership, so things like personal humility and professional will, and then emotional intelligence and self-awareness, so personal kindness, listening, right? What's somebody's name? Where are they from? What questions do you have? What can I do for you right now? Things like that. And you can kind of look at the rest of the list: kindness, altruism, responsibility, honesty and integrity, and attention, personal well-being. So I will throw that back to Zishan Beg to talk about what we did part 1.
All right, so we did this thing in 2 different ways. One when we were at our own and when we were at FMEC. So the way we first did this during our regular academic day, we divide the faculty into 2 different teams, and then they would pick residents for each of the categories that they were trying to answer. And then we would take those answers and we would see how each team either had like a comparable answer or did they not have the same answers and there was something else. And we put that later on as like a family feud type of thing. So we'll be doing the same thing today. Instead of having everyone divided team, we're just going to go into 2 different breakout rooms, I think. And we're going to have you guys with this prompt. That's the next slide. Take over. Yeah, the next slide has the question, Dr. Unikel. Do you have access to the slides? There it is. So here's our question. How is professionalism demonstrated in family medicine? And we want 1-word answers here. So we're going to break into 2 different groups. I don't know how many people we have participating right now. I think so. What? 2. All right, so we're going to be going into the family feud section now. I wish I had my microphone, but I'm going to be using my Apple headphones. But here we go, 4, 3, 2, 1. Can we get to the next slide? Are you ready for some family feud tonight or to this afternoon? Because we're going to be using your answer choices to see how each group did and you know how Family Feud works. For each question, for each answer, there's an associated point to it, but we're not going to use points. We're just going to see how we together answered versus each group on keywords to see how it came up. So for us, ours actually had, for number one, was respect. Can we actually go through each point, or is it not going to show up? Because then we can relate to see how they did. It's okay if we can. I'll just say the items that we picked up, and then everybody else, when we can look at the groups that they picked their, oh, there it is, perfect. Which each group to see how they did. We were in group, I forgot which group we were in, if there was a number associated, but they had integrity. I remember hearing some reliability. I heard, who was the one who was keeping the record for our team? I just want to hear our.
Yeah, that was me.
Let's go ahead. What do we get?
That was me. Okay, so we had respect.
Good.
And timeliness and teamwork.
Perfect. So we have timeliness, 3, 9, and 31. Perfect. Okay. And then who was the other team? Were they keeping a record?
I was with the other team and I kind of became the secretary. So we had attitude, conduct, commitment, and altruism.
Oh, wow. Okay. Yeah, those are some excellent choices right there. But you can see how you could use this, because for us, when we were doing this, we were showing the 2 different teams and all the different residents who were participating with the faculty, that we all have like a basic functioning understanding when we're trying to understand professionalism. But when we subsequently took this is, to me, from like a resident's perspective, these keywords help us to stay aligned with the idea, the identity of professionalism. But to really get a resident to understand what it means to be actively professional in their work ethic and everything, as we're giving these keywords, would be the next thing that we actually did together as a group. And we also did this at FMEC.
So, yeah, so you'll see as we go through, this had like 3 major parts of things we did, because we tried to really get at it in a variety of ways and make it interactive, because sort of felt like us telling the residents and even ourselves like what professionalism is, like didn't feel like it resonated. So this, as you can see, was really interactive. So the second part, after we did the Family Feud, and again, we kind of went through like what words did we come up with, and the ones that you saw on the Family Feud side, those were themes that were taken from when we did this as a group. So we pulled all the things we had come up with, and that's where those 5 or 6 came from. So the second thing we did was we asked each team to develop a scenario with their ideal example of professionalism, and then their scenario with a poor example of professionalism. And then we voted on which was best, because again, kind of keeping with some of our gaming feature, it was like an anonymous, again, we had a QR code. We're not going to get that complicated for this presentation and for time's sake, but what we would like to do is, again, go into 2 breakout rooms, and breakout room 1, we're going to ask you to do that first part. Develop a scenario, like what's your ideal example of professionalism? And then in breakout room 2, what's a poor example that you hope to never encounter? So I'm not sure if we can sort of define 1 and 2, or maybe whichever group I end up can be 1 and the group I'm not in can be 2. So 1 is going to do your positive example, and the group I'm not in will do your negative example. And again, we'll take another maybe 3 minutes to do that, and then we'll come back.
Professional behavior. So breakout room 1, what was the best example of professional behavior? What did you guys come up with?
So I was our note taker this time.
Okay.
And the mono resident arrived on time, having pre-charted, listened carefully as the MA presented the first patient and thanked them, knocked on the door, introduced themselves, sat down, and asked the patient how they wanted to be addressed. model resident then used eye contact and body language to spend the first 3 minutes listening to the patient's concerns. And then we shifted a little bit
Andrew.
to realize that another resident had not shown up for a clinic and had a reputation for sort of not always being where they needed to be. So model resident said, well, those patients need to get seen, and offered to see those patients also, and also said that if the MAs, if the clinic was short-staffed and extra help was needed, that the staff should just tell this model resident what they needed, and they would room patients or take blood pressures or whatever they needed to do. And that was as far as we got.
Nice. Very good. Does anybody have any other thoughts or things that they want to mention about sort of their ideal professional behavior? Okay. So
Yeah,
the next-
I was just gonna add, I think we probably need to be professional means to speak up when you see something that's not right. So I mean, I think that the doctor will need to close the loop by circling back to the resident or the resident who didn't show or the resident supervisor to say, hey, something happened in clinic that shouldn't have, and we need to have it addressed. I would do that.
Agreed. Yes, thank you. Okay, so this is what we used in our original presentation to our residents for best examples of professionalism. So this list was cobbled together by talking to, department chairs, former DIOs, office managers, and faculty from 2 different healthcare systems. So we see here offering to help even when it's not your responsibility. So kind of like the resident jumping in to see patients when somebody else either didn't show or had to call out sick, helping staff, getting rooms ready, or even rooming patients. I mean, let's face it, we're all pretty short with MAs. So it goes a long way to have residents jump in and help with that sort of thing. Touching patient on the arm, showing some empathy when they're in distress, understanding that fair and equal are not the same. These are discussions that I have not only with my toddlers, but also our residents. And then just being sympathetic to personal situations and, whether or not they affect work. So moving on. Do you acknowledge professional behavior when you see it? You guys can answer in the chat. The best way to increase a behavior is to notice it. We all know that. You want to be specific when you're praising and praise more than you think you need to. Oftentimes those general platitudes like, hey, you're doing a great job, they're not believed. They fall short. And as teachers, we often correct behaviors that need to be changed. But how often do we really point out the good ones? I know for myself, it's not as often as I would like it to be. Okay, moving on to group number 2. So those of you in group number 2, what was the example of unprofessional behavior that we discussed? So this was the group I was in. Somebody want to speak up for us?
Yes, it is poor response to calls when called in urgent situations, not attending to their duties on time. Like if a nurse called you for, let's say, the patient was crashing and the resident took their sweet time in answering the calls or showing up at the patient in the patient's room.
Okay. So not managing things timely, right? And just kind of going with the flow, not in a good way. Okay, so some of the worst examples of professionalism that we came up with in our group are listed here. So I'll give you just a minute to look over those. So some of these are pretty obvious: arguing, defensiveness, lying, yelling at others. Some of these are pretty benign, like the cliques and the gossiping. But then others are a little bit more concerning, like claiming to have done a procedure or an exam without having done so, right? So these range from pretty benign to pretty concerning. So how do you correct unprofessional behavior? So first, you have to identify the behavior, offer up or provide a replacement behavior, and then reinforce the replacement behaviors. So it's important to remember to reinforce approximations if the replacement behavior cannot be generated exactly. All right, throw it back to you, Zishan.
Perfect. So this would be the last piece of the whole professional training that we did. First with the key term identification. Right after that, then for us to come up with different ways or different scenarios in our own words, what we thought was a good case of professionalism versus unprofessionalism behavior. And then the last part was we broke out into smaller groups on an academic day, each one led by a faculty member. There was a note taker in the group, and then eventually there was going to be a presenter, because we were going to come up with our own cases, or we had cases come to us and we were going to break them down together and find different ways to really understand what unprofessional behavior was part of this, what professional behavior was part of this, the prompt itself, and then how would we react at the end of like the case. So for example, this is, I can go, there we go. So here we go, we're in a clinic. You hear some of your fellow residents talking about everyone's schedules. They are complaining that Dr. Sackler always has fewer patients and never seems to have patients past 4 p.m. Another resident says that they heard Dr. Sackler yelling at the front desk staff the other day for scheduling a patient at 4:40 p.m. So when we were, as a group, we would break down this together. This was just one of the prompts, because we have a QR code right after this that has the other few prompts that we had for our case studies. But this is the one that we're going to do today. So we're going to try going back into our breakout rooms. We have enough time, I think, just to do a 3-minute breakout room. And what we're going to do is we're going to have, we're going to break down exactly what happened here. How was this professional behavior? Would we react from this? What kind of unprofessional behaviors is? How would we address this? So each of these type of questions we were trying to answer as each small group. And like I said, each group had their own case study. So this was just one case study that we chose to do as a group today. We used the same one during the FMAC presentation last year. Can we get a breakout room for 3 minutes? So here's, and I'm sorry, this is where, these are the questions that we were asking ourselves for the case study itself. And that QR code, you're welcome. I think they still work, if I'm not correct, Dr. Unikel, for all the different cases. And feel free to take that and use them at your campuses as well. But we really wanted to see if we can get a conversation going about what are the issues or concerns here, what should be done, what other thoughts or concerns in our group. I think Dr. Unico was writing down all the notes about the what our participants were saying. Do you have anything written down about the conversation we had? I remember a lot of it, if it's okay. I mean, they had very good.
Do you want me to start?
Yeah, go ahead, please. Yeah.
So our group identified 3 issues, and they said one was sort of the talking about schedules and complaining about it, which are 2 issues. One, it's not your business what everybody else's schedule has, and 2, the complaining about it. The second was the sort of sense of entitlement by Dr. Slacker of, that when they ended their day. And then the third was the emphasis on getting out on time versus patient care. And then in terms of what should be done, there's a conversation about 2 things: responsibility and justice. And one was sort of this idea that in medical school, they learn, or the students are learning, right, how to do things, but not necessarily like the how to be a physician in the clinic part of medicine, and that's this responsibility, and that you took on a job and you have responsibilities, and it's not just a diagnosis or ordering a test, but treating patients with dignity and respect, and having, engaging with the residents in conversations about this, and that this is part of the job too that they signed up for in the contract they signed. And then the other piece was also this idea of talking about justice in a positive and thoughtful way.
Right, absolutely. This is great conversation starters. I loved every one of that. Brought some new topics in there, especially the justice part at the end. That was really good. Something we're going to have to start talking about on our campus to bring it up. That seems to be like an appropriate way of keeping it like in a positive light. So that was very good to bring up. How about Dr. Strom's group? Did you guys have anything?
Yeah, we sort of ran out of time, but we said a lot of the same things. I think the things that came up that were a little bit different was this idea of perception versus reality. So one of the physicians in our group mentioned, I really would like to talk to the team leader and see if this is a perception that Dr. Slacker is not seeing patients after 4 or seems to get out early all the time, or if that's actually the reality of the situation, right? And if in fact that is the reality, they mentioned sort of bringing the resident in and asking the tough questions, like, what do you need from us that you're not getting? Like trying to find out what else is going on under the surface. Is there a childcare issue or a pet issue or something that they feel like they need to constantly be out of the office earlier than anticipated?
Right.
Then we started talking about the yelling aspect, and then the breakout room was over.
Right.
But I could tell that the conversation was going in the direction of, sort of assessing their needs and their, mental health and stuff like that. Like what's going on that's prompting or triggering this type of behavior.
Right. Absolutely. So yeah, there was great conversation happening here, both sides. I mean, that's exactly how we had ours going to with each different case study. And we ran out of time for each thing too, because, you want to sit there and you want to really break it down and you really can identify with some of this stuff too. So that really helps to get the residents themselves to just talk amongst themselves, to not just, as Dr. Strom just literally said, the perception of what you're seeing. Like, are you really seeing that? Is that really occurring? So take a step back maybe. And we discussed that during one of our cases. I remember that very well. But because we're pressed for time, let's at least move on. I think we're going to be talking about now, if I could just go next. There he is. So can bias affect our understanding or just basically professionalism itself? Cultural biases, gender biases, and are these cultural biases differences in, like, are there any that they like were in profession itself that we're looking at culture, gender, whatever it may be? Like, how are they inside of professionalism and how do they break down for our own understanding what we're doing with patients? So I think one of the faculty here today was mentioning when they walked in the room, they're, how do you want me to address you? When we just don't think about those things as residents right away as we're being trained. This slide right here helped us to identify or at least just on the surface understand our own biases, how they impact our professionalism. And then what else can affect how we interpret professionalism? So these are things that the residents were prompted by Dr. Dienickel and Dr. Strom during one of our academic days. It was at the end of our case study, if I'm not mistaken, that day where we discussed this. But I think because of that, it helped us, for myself, because coming as a South Asian individual, I was trained in the South for medical school. So I was apprehensive sometimes talking to patients, but they were very cordial, very nice. And so my own perception was, how would they look at me? I should have just realized as I walked in the room, they're going to treat me like everybody else, a doctor, because that's what they're here for today, even if I was a student doctor at that time. So we should be very conscious of how we alter our professionalism with our patients, with our colleagues, whatnot, predicated on our own cultural or whatever biases that we retain within ourselves. We must identify them before they become a systemic problem in our own career. Is what essentially how I interpreted this. Dr. Unico, you're welcome to add on to that. I think that was pretty much how we use this idea here.
No, I think you did a great job. Does anyone else have any other thoughts on sort of how bias can affect professionalism?
I think one thing that came up during a previous presentation of the same material was the idea of, back in my day, residency was X, Y, and Z, right? And sometimes part of the quote unquote old guard, right? What we knew to be the rules when we were in residency, what the expectations were when we were in residency, right? It has evolved a little bit, and sometimes we see residents wanting to leave at 5 as more of an unprofessional behavior and less of that work-life balance, that well-being, just because that's how we trained, right? We trained to stay until the job was done. So I think sometimes that generational gap, if you will, can create some bias that affects professionalism or interpretation or perception thereof.
Okay, if we have no more further comments, we can go on to the next slide.
So again, we had done this with a QR code, but you can unmute or add it to the chat as we kind of summarize and come to the end of our discussion. Now that we've spent the past 50 minutes, what are behaviors related to professionalism? I guess, what's the takeaway from this? And again, if you want to put them in the chat or unmute.
So I see taking responsibility for what you signed up for.
I don't know why it's doing that.
Wait, you went to, do you still have control?
Yeah, I'm trying to go backwards. Here we go.
Passion for self and others, respect. Respectful and courteous language and behavior, responding to patient needs in a timely manner, treating all team members with dignity.
There's a lot to professionalism. It involves a lot of things. So as we, you'll see on the next slide, we asked this question at the end of our didactics when we did it with our residents, and we did a word cloud that you'll see in a minute. But as you saw throughout the presentation, we covered professionalism from a variety of angles, right? We started in sort of the gaming with the Family Feud and just getting people brainstorming. And then we had people develop their own examples. And then we had examples that we broke down to have conversations about. And as I said before, we really wanted this to be interactive because in our minds, it got people thinking about sort of like, not just what is professionalism as we stand up here and talk about it, but like, what are the behaviors? What are the things that go with it? And then with some of the case studies to break down, like, why were these behaviors not considered professional? And what was it that we needed to address when addressing these behaviors? The other thing that was interesting is when we presented this in the fall at FMAC, we had several of our residents in the room with us. And the feedback we got was that they found it really interesting to hear program directors or other faculty members, right? That's who mostly attended this presentation. They found it interesting to hear kind of not just from us, but from all, people affiliated with other programs. Oh, these are the same conversations that are going on, because like we said, we did these same exercises at FMAC and we broke them into groups. And we sort of heard some feedback too, that some of our residents that were gonna stop and maybe do a little bit more sightseeing went home to finish some of their notes after hearing our presentation. So I think just this idea of, it's not just our programs. I think sometimes we can feel isolated, but knowing that these are all things we're addressing. This was just a very surface level 1 hour didactic that we did, but a way to start opening conversations and getting, our residents involved with our faculty, right? It wasn't one or the other. It was meant to be conversations, and each had things to say. And I think we learned from each other about it too. If you want to, Zishan, do you still have control? I think you might.
Yeah,
Right.
on the next slide.
Okay, so this was our word cloud. So again, I think a lot of the things we brought up, so integrity, respect, communication are kind of the biggest ones, but consistency, empathy, timeliness, attire came up, adherence, clarity, duty, compassion, certifications, punctuality, listening. And like I said, it's just, I kind of like these word clouds sometimes to see, right? The bigger ones are the ones that more people respond with. So I think it's interesting. And then our references, and just to end before we take questions, professionalism is not a label you give yourself. It's a description you hope others will apply to you, right? It's something we all want to be considered professional. We all hope that we show up to give our best and to do it in the best way we can every day. And so with that, I think we have a couple minutes. Are there any sort of questions, comments, thoughts?
Thank you all so much. That was fantastic. Does anyone in the group have any questions?
Looks like there was a thing in the chat about having to jump off, but they'd like to borrow from the slides to prepare a professionalism lecture for their residents. Looks like that was Dr. Frazier. So maybe Lynn, you could get in touch with her.
Yeah, if someone can send, is there an email there?
Sure, we can put you in touch, and we'll also
Okay.
we'll post the recording and the slides on our website.
Perfect. Perfect.
I have one question for you. When we think about the things that we teach in the course of residency, it's relatively easy to think about how we teach someone to diagnose and treat diabetes, or how to use the EMR, or even how to be efficient in clinic. It's a little harder to think about how do we teach someone in their late 20s or 30s or 40s about how to respect your teammates and colleagues. How do you approach that?
That is a great question. I think it's multifaceted, like anything else. I think one is modeling it. I think two, again, is asking, having the behaviors that you're concerned about and mentioning one or two, and then asking the learner, these things have been brought up. Do they understand why they're concerning? And then maybe jumping off from there. And if they don't understand why they're concerning, that's like a whole different conversation. If they do understand why they're concerning, what's getting in the way? And same thing, breaking down, like, are there things going on outside of residency that we don't know about? Are there substance abuse or mental health or domestic issue, whatever it is. And I think it's that same thing is, I think we can't emphasize, and I know the faculty in my program get tired of hearing me say it, but I think we can't emphasize enough, like reinforcing the positive behaviors, because I think we're sort of like, well, that's what we expect. Why should we reinforce it? But we all like to be reinforced. So pointing out the positives, and especially for that resident, if you do see them starting to change, sort of like really acknowledging the changes that you're noticing. And if you're seeing unprofessional, like, oh, you know what, you showed up late for clinic, this has become a pattern, like, let's see how we can work on this, and how can we, like sitting down and problem solving and finding replacement behaviors for the behavior. So I hope that's at least a start. I don't know if anyone else wants to jump in.
Well, that was great. Just a good reminder for us all to keep an open mind, call out the good when we see the good, and then think about how to approach with curiosity when we see something that doesn't fit with at least how we think professional behavior should look.
Mhm.
Awesome. I love this topic. It's one of my favorite areas of what we get to do in residency, as challenging as it is. I think as you guys pointed out at the beginning, it's issues with professionalism that will be the thing that gets future physicians in trouble. And so the better that we can address it, teach it, role model it while they're in residency, the better off our graduates will be.
Mhm.
The awesome topic, very nicely presented. I enjoyed your presentation, and thanks for being a part of our seminar sampler this afternoon.
Thank you for having us.
Thank you.
Yes.
Thank you.
Appreciate it.